Hello, everyone. My name is Shusha Novadalis, and today we will be discussing Dorothea Orem's self-care theory. In this presentation, I will give you a background on Dorothea Orem herself. We will discuss her theory, the strengths and weaknesses of it, and then we will review a case study discussing how her theory can be applied to nursing practice today. Dorothea Orem was born in 1914 and lived through 2007. After receiving her high school education in Baltimore, Maryland, she went on to a nursing diploma from Providence Hospital School of Nursing, then went on to a bachelorette and a master's degree from the Catholic University of America. She then went on to serve as faculty at this university, contributing to nursing education in various positions, even working on state boards and in the Department of Education. Through these positions, she shaped what we know as nursing today. Dorothea Orem was impacted by her service as a nurse, both clinically and as an educator. She was astounded by nurses' inability to describe what nursing was while possessing the ability to do the work of a nurse. She saw that as a limitation, preventing nurses from being able to advance the practice. Throughout her life, she contributed to and authored many works that has shaped our practice, including the publication of Nursing Concepts in Practice, which was the original foundation for her theory. Dorothea Orem possessed a more practical approach to nursing, saying that they should not only consider the what and why, but also the who and how. She saw clients as an active participant, able to interact and collaborate in their care. Let's review some of the major concepts in this self-care theory. Dorothea Orem saw nursing as an art in which the nurse provides assistance to those with limitations, a self-care agent with a goal of getting a client to be as independent as possible in their self-care. She was sure to point out that we are all humans, social units who all require some level of care. She addressed the environment as a contributing factor that impacted health, not only physically, but culturally and socially as well. She defined health as being structurally and functionally sound. She also defined self-care as the activities that a person can perform on behalf of themselves to maintain life, health, and well-being. Self-care agency was described as the person's ability to engage and participate in self-care activities. Basic conditioning factors includes things like gender, age, developmental status, and other sociocultural factors that also impact health. Therapeutic self-care demand is a comprehensive self-care actions that are performed over time. Self-care deficit was described as when a nurse is needed, when a client is not able to provide self-care either partially or fully and requires some level of assistance. Orem describes nursing agency as a group of people who are specially trained and able to act, helping others meet their self-care demands. And finally, the nursing system was described as a series of relations between the nurse and client, the collaboration as the nurse helps the client achieve independent care. As you can see, after reviewing these terms and key concepts, they're all interrelated. If you look at the diagram here in the middle, you see that all these concepts are factors that impact health. They impact the nurse's ability to promote health and the client's ability to participate and achieve the goals they set together, with the goal of being as independent as possible. Studies show that patients who are more involved in their care are more compliant and receive better outcomes. The overarching theory here, the meta paradigm of her theory, is actually three interrelated theories. The theory of nursing system, which is the relationship between the nurse and the client, the theory of self-care deficit, which is when nurses is needing, and the theory of self-care, which is the care for oneself. These are all interrelated and, as I said before, all impact health. Dorothea Orem developed these theories as a theoretical structure to improve nursing practice. These theories provide a clear specifications for nursing and client roles and are the building blocks for the nursing process as we know it today. The diagram here explains the conceptual framework behind the nursing theory and how developing nursing agency empowers the nurse to develop and promote the client's self-care agency, enabling them to perform more self-care activities, which then allows them to address their self-care demands and self-care deficit issues that they may possess. As you can see on the sides, the contributing factors are not far and not to be excluded. The nurse still has to account for these and address them, helping the client navigate through these issues when trying to achieve optimal health goals. Dorothy Orem's assumptions of nursing, accepted as truths, values, and purposes of nursing, is that we have the power to help the client stay alive and function. We possess the ability to act deliberately and make judgments on their behalf. We can take action and we can help the clients take actions towards self-care. Nurses, as I said, are self-care agents in that we help a patient develop, communicate, and discover their needs. And as nurses, we share the overall responsibility as well as other providers to take care of each other, to take care of others as humans. So let's look a little closer at these theories. The theory of self-care, firstly, as you see here, is defined as actions performed toward the goal of maintaining life, health, and well-being. These prerequisites listed here are what we would consider activities of daily living, things that promote health overall. Universal self-care requisites include things like getting enough air, water, food, taking care of the elimination processes, getting enough rest, maintaining social interactions, and preventing hazards to health and life, promoting education, promoting development, and overall well-being. The developmental self-care requisites are kind of rolled into this as stated in previously. Healthcare deviation, self-care requisites is about the use of the medical system, seeking assistance when needed, being aware of one's condition, seeking medical advice, following prescriptions and therapeutic measures, modifying one's self-image and self-concept based on their needs, based on health conditions, and learning to live and cope with chronic conditions that may impact your overall health function and independence, learning to adjust one's lifestyle accordingly. The theory of self-care deficit is when a client is incapable or limited in their ability to provide continuous care, and in this situation, a nurse is needed. Dorothea Orem's 5 methods of helping can then be implemented to help the patient achieve independence or as much independence as possible. These 5 methods of helping are acting for and doing for others, guiding others, supporting another, providing an environment promoting personal development, and teaching another. These 2 theories, as you can see, are related in that one addresses ways to maintain care, maintain health overall, and the other addresses when a nurse is needed to interact and intervene when a deviation or a complication occurs that may limit the patient from being independent. The theory of nursing system is about the nurse-client relationship, the interactions that occur when the patient's self-care needs exceeds their self-care abilities or agencies. The 3 aspects of the nursing systems are wholly, partial, and supportive or educative. This is basically saying that the nurse's interventions are based on the client's level of need. If the client needs total care, the nurse has to complete all activities of daily living, everything that the client needs in order to maintain health. Partial means that the client is able to interact somewhat, may be able to participate in their care, but the nurse is still needed to help them along. Then supportive and educative, the nurse may not necessarily be needed physically, but through education and support, they can help guide a patient address their self-care deficits and achieve their healthcare goals. We see this in our various types of healthcare settings that we work, where you just tailor your nursing practice to what the client needs. This requires you get to know your patient, understands what their needs are, and then tailoring your interventions to help them get to their goals and be more effective with the assistance that we are able to provide. As I stated before, Dorothea Orem self-care theory is the foundation of the nursing process that we know today. The goals are to address the self-care deficits of our clients, define our role in their journey, and the client's ability to assist themselves in meeting their self-care demands. Using assessments, we work with the client to determine if assistance is needed and how much. We then make nursing diagnoses and develop care plans to address these deficits. We then implement interventions that are agreed upon with the client to assist them achieve their goals, and then evaluate the effectiveness of those interventions based on the goals that we set previously. This is the process that we have learned throughout nursing education, we implement throughout our practices, and it all started with the simple self-care theory. Some strengths of Dorothea Orem's theories is that it is applicable to nursing. As I said so many times so far, this is something that we know and we use and we are familiar with. The terms are easily understood and are universal, can be adapted to various settings. It is comprehensive because we can use it at the bedside, we can use it in the clinical setting, long-term setting, education. It encompasses the patient's social aspects, it encompasses their health overall. The roles are also very clear. We know when a nurse is needed, when a nurse is not needed, and we are encouraged to develop a patient's abilities to help themselves. That is usually very, very important to me at the bedside. I want a patient to feel like they're empowered, they can help themselves, and they can be independent again once they're feeling better. With all things, there are limitations. After reviewing and researching Dorothea Orem and going through the chapter, initially I can see where some of the terms overlap and they can be a bit confusing. So self-care agency, self-care demand, self-care deficit, a lot of these terms sound alike, look alike, and have similar meanings. And it could be a little bit of an effort to understand this theory, and it took a while to actually go through it. So for the nurse beginner students and even not so beginner, you have to kind of go through it, and once you understand the terms you can then apply the concepts of this study, of this theory, excuse me. Also, I do think another limitation is that it doesn't address emotional need, it doesn't address psych as much, and we see a lot in this in our practices in the bedside where a nurse's ability to implement interventions based on a client's needs may be limited because of a patient's mental health. And so Dorothea Orem did not exactly touch on the mental aspects of this. And that's one of the limitations that I found. After reviewing the self-care theory by Dorothea Orem, let's discuss the applicability in use of a case study. So Novla Dallas is an African-American woman, 59 years old, had diabetes for years. She tried her best to maintain her diabetes, but eventually developed a wound on her foot that led to a below-the-knee amputation. She is in the hospital, received her care, and is ready to be discharged, but may need services. She has very much verbalized that she does not want to go to rehab and she wants to go home. The nurse taking care of her is Sarah. Sarah has been her nurse for several times over this hospitalization. Sarah has spoken with her family, spoken to the patient about her background, about her Christianity, about her desires to avoid rehab, and she has a good understanding and a good rapport with the patient and the patient's family. So in assessing this patient, Sarah notices that the patient is of sound mind, can make her own decisions. She has verbalized her desire to avoid rehab, and Sarah decides she would like to help her achieve this. She works with physical therapy, and based on their recommendation, she will need education and supplies and support to optimize her function going home. Sarah decided to apply the concepts of Orem self-care theory, self-care deficit theory to be specific. So, in making her nursing diagnosis and developing her care plan, she decided that this is a partially compensatory nursing system and a supportive education system. The patient is somewhat independent. She can do certain things, she can help herself to some extent, but requires assistance and requires education. The nurse is helping her get home instead of rehab and is tailoring her interventions to help promote independence as much as possible. And this is important because we see here that individualized treatment plans are known to increase self confidence, self compliance, and lead to better outcomes for the patients overall. After assessing the client's needs and addressing the client's desire to go home, and be a little bit more independent, the nurse has tailored her nursing care plan and interventions to address those needs. She is ready to implement those interventions. After completing extensive education and demonstration and watching her work with physical therapy, the client is asked to demonstrate understanding of her abilities and provide some self care. The nurse watches the patient complete these tasks such as getting ready, getting out of bed, using mobility aids such as a walker, and also assesses the family's ability to provide assistance as needed. Once Sarah, the nurse, feels that the client is able to perform these activities adequately and feels comfortable with the family's ability to support the client, she, as a nurse, feels more comfortable recommending that this client is safe for discharge. As with any good patient treatment plan, there are some modifications that are required to make sure the client is successful in the long term. This includes setting up physical therapy at home and nursing visits at home, which will help the client progress on their self-care and independence journey. The entire goal of this is to help the client achieve a more improved quality of life. By increasing their understanding of the interventions, including the disease process, we help them be more deliberate in their actions, developing that self-care agency, which leads to better outcomes in the end. I hope you were able to see here how Dorothy Orem's self-care theory was used in this case study and helped this client return home and achieve a little bit more independence, despite the fact that she was an amputee, despite the fact that she had chronic illnesses. They were able to work together with the client and their family to develop a goal and then work towards it, implementing interventions that were client specific to this situation. They encouraged self-care and participation in the nursing process. Dorothea Oriam's theories really resonated with me. I chose them because I felt like it was something that a nurse, regardless of experience, could implement. It is empowering, it is applicable, you're able to see and measure your ability to impact change, and I feel like it is quite comprehensive, addressing multiple areas of a patient's life where they can be a participant in their journey towards health. These are my references. Thank you so much, everyone, for listening and taking the time to share this theory with me. I hope you all have a great rest of your day.